Welcome to this week's edition of Healthcare Insight. We're so glad that you joined us and hope you've been following along in this series of podcasts on how to create a private free market system. For those of you who've been watching, we got a new banner behind us here just to emphasize the name of Healthcare Insight as the name of these broadcasts and how to get in touch with us on americaswebradio.com and on also at healthcareinsight.net. So let's just back up for a second in this fourth in our series of podcasts and do a little bit of a summary before we move forward. Many people who are picking this up may not have been involved in the earlier sessions, so let's just do a quick recap and go through frequently asked questions that have come up from the first several sessions. The first is, what is the difference between health care and health insurance reform? Well, while they're intertwined, health care is how one receives services from medical providers, that is, the doctors and hospitals. And health insurance is how one finances those medical services. A negative interaction arises when health insurance limits access, restricts treatments, denies coverage, or unnecessarily intervenes between the patient-provider relationship and controls the delivery of provider care and treatments. We'll often talk in these sections about what is self-insurance. Well, self-insurance or self-insured group health plans is one in which the employer assumes the financial risks for providing health care benefits to its employees. Typically, large employer-sponsored plans are self-insured. They are also sometimes referred to as self-funded plans. So what is the other term that many of you probably heard? What is fully insured versus self-insured that we just described? Well, a fully insured health plan is the more traditional way to insure and structure an employer-sponsored health plan. With a fully insured health plan, the business pays a premium to the insurance carrier for the payment of any claims. Now, there's some other terms, especially around these ideas that are developing on the political front: socialized medicine versus private markets. Well, are Americans supportive of socialized medicine? A recent Reuters poll found that Americans initially supported Medicare for all, 56% to 42%. A 14-point differential in favor of Medicare for all. But once people are told that a government-run system could lead to delays in getting care or higher taxes, the support for Medicare for all plunged from 56% to 26%. So on the flip side, are Americans supportive of private health insurance? Well, 71% of Americans are satisfied with their current employer-provided health coverage. And since not everybody gets employer-provided health care, many are with government programs. Of that 71%, that represents a 73% satisfaction rate for those 76.2% of Americans age 64 down to age 0, non-Medicaid, non-Medicare population basically, who get their coverage through an employer-sponsored, employer-subsidized group plan. So clearly, Americans are much more in favor of private health insurance than they are of socialized medicine, especially once they understand the problems and difficulties of socialized medicine. So what are the problems with socialized medicine? Well, socialized medicine and government-controlled health insurance is a seductive concept. Americans have little knowledge of the problems, restrictions, treatment limitations, time delays, poor quality of facilities, and limited service in the socialized system. Socialized medicine is generally promoted as one having equal access to universal care. In many European countries, this is referred to as solidarity. That's a common term you'll hear among progressives and among Europeans talking about their health insurance. The reality for patients, though, is equal delays and limited service for all in need of treatments. In Germany, a healthcare system that I have studied, and other European countries with socialized medicine, the reality of solidarity is a false concept. Government officials, unions, teachers, and other favored groups have access to better insurance, faster medical care, and better treatments than does the average public or Joe Sixpack. But private insurance isn't great either. And what were the problems with private insurance pre-Obamacare? We had a lot of problems. We did not have a free market pre-Obamacare. So what were the problems of that so-called private insurance pre-Obamacare? Well, there are no implications that pre-Obamacare healthcare was a great system or showed America at its finest. In fact, it lacked many features of a free market. Consumers were powerless when seeking to purchase coverage from insurers. They could put in an application, then they just had to wait and see if by the luck of the draw or the luck of the underwriting process that they made it through. But they didn't know for sure that they had coverage when they made the application. They didn't know that they were guaranteed to have a product at some price or with some restrictions. They could just be rejected outright and they'd have no understanding as to why. Third, the cost and quality information was non-existent. If you don't know the cost of services and you can't compare quality across different providers, you really don't have a free market. Fourth, individual consumers had little or no power to negotiate premiums or understand why they were rejected for coverage. And fifth, limited competition among insurers as they consolidated into larger and larger entities. Consumers were restricted from various coverage alternatives, of plan choices, of innovation in services and in products. And it's certainly restricted in terms of pricing competition because there just weren't many options. So there is no intent to revert to that system. Republicans must coalesce around a new health insurance system that is consumer-driven and patient-centric. That's the key. It has to be consumer-driven and patient-centric. So how would the United States move to a socialized system if that was the direction we head? Well, that debate will likely be resolved through the political process of elections. If Democrats control Congress and the presidency, the country will move in the direction of expanded government insurance, things like Medicare for all or single-payer system. The Democrats' version of private market, if that's where they want to make changes rather than the full government takeover, or maybe as an interim step, some version of private market, would involve more Obamacare subsidies, increased regulations, and expanded Medicaid. Not really private market, just more government control under the guise of letting the private market insurance companies do the processing. If Republicans control power in Washington, D.C., private market reforms will be allowed to finally repeal the Affordable Care Act. Large group regulatory relief can be given, certificates of guaranteed coverage will be provided, and the Impaired Health Support Group, which we'll fully describe today in one of the other sessions. The Impaired Health Support Group, which is a structure for the uninsurables, the people who need the most help, the sickest among us. We're going to be able to create something that helps the sickest among us. That's the real key to a fair, compassionate, private market system. So private market solutions for these populations would create a consumer-driven and patient-centric set of products and services. So let's talk about some other questions that have come in since we first started these podcasts. Is Obamacare in a death spiral? Now, we spent a whole session talking about that. But yes, Obamacare no longer works. Obamacare is in the end stages of an actuarial death spiral. Obamacare depended on mandating that younger participants buy insurance and pay more than their actuarial equivalents in order to offset the higher costs of older participants. With the elimination of the individual mandate and associated tax penalties in 2019, young and healthy individuals can now legally avoid purchasing overly expensive Obamacare insurance. That means only the sickest will remain. Only those who expect to have major medical expenses will purchase insurance. So what about the repeal and replace legislation? The Republican challenge is no longer to repeal and replace Obamacare by itself, especially just repealing. We are beyond the point of no return. We are beyond the Tea Party opposition to government control of healthcare. We are beyond the anger of the 2010-2016 elections and the lie that if you want to keep your doctor, you can keep your doctor. We are beyond the lie that the Affordable Care Act will reduce premiums by $2,500 per family. Remember when all those promises were made? They were promises broken. But most Americans are now facing the dire prospect of a failed Obamacare with no acceptable alternative that they understand. Americans are justifiably worried that under a Republican plan, they will not be covered for pre-existing conditions. To date, Republicans have simply had bumper sticker slogans about pre-existing conditions, but no structured, definitive outline plan has ever been made available to the general public. Not that there haven't been attempts, but they really haven't gone very far, and there's been no coalescing around a single approach. So, with all that, won't Democrats just be blamed for the failure of Obamacare? Well, I believe Republicans will be blamed by the Democrats and the media for the failing of Obamacare. They will say Republicans failed to address the issues to improve Obamacare, and Republicans never offered a viable alternative. And unfortunately, there's a lot of truth in those statements. Since the passage of the Affordable Care Act, or Obamacare, in 2010, Republicans have been long on slogans and general concepts and too short on specifics for a plan to repeal and replace Obamacare. Well, I'm excited about the great response we've had so far on this series of podcasts. I don't know if you're watching it on the video, because it's available in some cases on the website, on YouTube, on healthcareinsight.net. If you go on YouTube, it's under americaswebradio.com. You'll search for Healthcare Insight. And we should be able to work together to understand what needs to get done and be able to work with those folks around us. We may know a politician, we may know an influencer, we may know somebody in the insurance industry, we may know an elected official or somebody running for the office that we can talk to about healthcare reform, and we can point them to some of this information. So we're going to be back in just a few more minutes for the next segment. We're going to really delve into more of the details now that we've covered some of those questions and answers as a area we can just get everybody up to the same speed as we move forward here. So let's find out more about the details, about how and why all this will work, the system that I've been calling MAGA Health.